hospital, that we judge you not on the number of procedures, but on the outcome and the condition of the patient when they come and the condition when they leave. And if it means an extended stay for someone with chronic heart disease here, then I think you should be paid exactly the same as everybody else. You are providing for that individual's care, and probably a higher quality care in some ways, and probably a more comfortable setting, and we're close to family and friends and all those quality of life things that matter whether people get well or not. And so I'd like to see across the board that every standard be the same. And I really believe that if someone who is low income here in Grinnell, who says that, I've got $2,500 for my insurance, and I want to buy a policy that means I come here to this hospital if I'm ill, not to Des Moines and not to New York City or wherever it is. So, you see, the more government gets involved, the more complex it gets, and also, so they see the cross going out of control. So let's whack the hospital and let's whack the doctor. And by the way, I didn't mention one other thing that you all know that is very bothersome to me, and I know it's bothersome to you. For all of our nation's existence, we've had the highest, most talented people in our country become into the medical profession. Doctors, nurses, caregivers, etc. You know what's happening now, and I think you know that. A lot of young people are saying, I'm not going to go through 8 or 10 or 12 years or whatever it is training and not get the kind of compensation that I might get if I ran a hedge fund or, all the other things. That's a problem in America. We've got to continue to attract the highest quality people as caregivers from our nation's population. And if you keep squeezing you, and you have to squeeze the doctor, and you're only getting 60% back on 100% investment, who in the world's going to get in that business? I mean, it's crazy. So that's why I think, and some of my ideas that I mentioned are pretty revolutionary. But it really is based on competition and based on the free enterprise system and incentives not to use health care except when absolutely necessary. And the more complex it gets, the more you find different categories of hospital giving the same care but getting different reimbursement. It's nuts. So it's not a very good. Dan, I have an advisor, the beer ugly guy back there is my healthcare advisor, and he's been involved in it all his life. He's been through alcohol rehab several times. So
but you meet some really nice people in rehab.
Go ahead.
I don't have much more to add. The complexity that you guys find yourselves in the rural-urban disparities and floors and all the nonsense as well as I do, we've got to get rid of this. I mean, we spend all our time trying to figure out how to get with the rules or around the rules and not give them care. And the administrative overhead is just nonsense. So I can't add much to what you said. We need to start over. We need to rebuild the system.
I have a doctor, a friend of mine. He said, if someone breaks their finger and they come to my office and I put a splint on it, I get paid a small amount of money, reimbursement. If I send them to the hospital, I get a much larger reimbursement, where they have the same thing done, only it's done in the hospital. Now, how does that make any sense? Go ahead. You wanted to say something.
We've got a couple of ideas that we'll just send with you. That actually in your packet I see you have in your hand.
Well, give me one of them.
Well, one of them is there's a formula that currently exists. It was put in place a number of years ago to try to deal with this issue of volume and sometimes disproportionate amount of patient care, and because we get paid less than cost, we can't make up for it. So there was a formula that was put in place. It's just outdated. It just never got updated because, frankly, all the really small hospitals got taken care of because they're on a cost-based system again. So it's an example of a formula that is just tweaked a little bit. It's not going to make us whole, but it might get us back to where we can stay open, where we can literally still keep taking care. And so those are some just kind of technical kind of corrections that can be made. I agree, they're just additional Band-Aids, but I can't wait for a reform system. We're anxious to get there. Clearly, if we can come up with a way that is going to reward based on cost, efficiency, and outcomes, we'll be golden. Because we've been pinched so long that Our increased costs here last year, you know what we kept our increase to? 1.2%. From 05 to 06, we kept our expenses at a 1.2%. We're good at saving money. We've had to, you know. So when we get to a system that rewards efficiency and rewards outcomes, we're going to be great. The problem is getting from here to there, because it is going to be a challenge. Politically, it's anathema to talk about increasing taxes, cutting benefits. It's easier to cut hospitals and docs. We know that. We get that. But I think it's really going to take some guts to talk straight to people that say, just look at the numbers, you know. So we really support the notions that you're talking about of reforming the system, but we're going to need some help between now and then, just so that we can. And just one idea, just to throw out there, as you think about kind of what's important. Here's an idea. One of the worst things that happens in healthcare today is sometimes we get put in a position to provide care for people when they don't want it, because they're not in a position to speak for themselves, and they never put it in writing. They never put a living will in place. They never put a durable power of attorney in place. And so not only do we spend resources on people that don't want it, but we also sometimes put their families into a burden. Why not make that just a simple part of Medicare? It's such an awesome benefit. When we hand a card to somebody that says, here's your Medicare card, just tell us, just put it in writing so we know, since the government is ensuring your health, just so we know. Not only would we save money, but by golly, you know, you do such a favor to American families that don't even know how to begin that conversation. I can envision a really nice pamphlet in the Welcome to Medicare packet that says, here's end-of-life care, here's some things you ought to think about, here's some questions and conversation you ought to have with your family, and we really need to know what you want if you're not in a position to speak for yourself. So that's just one idea to save money and actually help people through that situation.
I agree totally. And a living will is something that if anyone in this room or anyone in America doesn't have, then obviously they're putting a burden on their family members that they shouldn't. And I know that everybody knows about hospice, and it's one of the choices that people can make, and we would never want to restrict those choices. Not long ago, my wife Cindy's mother underwent hospice, and frankly, I couldn't have been, we as a family who made the decision could not have been happier with the way that she crossed over the bridge, as they call it. But that's an individual decision made by the family members, but at least, as you say, that should be known at the time when perhaps they're unable to communicate their wishes. And I totally agree with you. But it sure is family decisions, as we know. We wouldn't want the government involved in that anyway. Any other questions or comments or insults? Yes, sir.
In light of your thoughts on personal responsibility, I've read about a number of companies not hiring people because they've said in their application that they're smokers or have some other sort of health ailment, possibly because they're worried about the healthcare costs considered. The healthcare costs coming along with hiring a smoker or something. I was wondering what your thoughts were on where you draw the line between personal and private when companies have to deal with their employees' health benefits.
I don't know the answer to that very well, and okay. I wish I did, but I do know this, that we obviously should put into place incentives. I'm not sure you should bar somebody because they're a smoker or other personal habits. I'm not sure where that would fall in discrimination laws. But I do know that we should, and a lot of companies do this now. If you'll join the health center and you'll work out and practice wellness and fitness, then they'll reward you, either by paying for that or additional money that you can use just as you want to. But I think the way to go is not to bar people because they may have some habit or something like that, but reward people as an incentive for practicing wellness and fitness. I think would probably be a better way to go rather than barring somebody from employment. And you know, again, this goes back to this previous question about smoking. I just worry a great deal, and I do not understand when you go to the movies why so many of the people in the film are smoking. I really, there's more people smoking in the average film